Hello. Hey.
Hi.
Hello.
You guys are here right in time for the YouTube
Yeah, we're dropping right in. Is it working? Yeah. It's
Hi,
working.
friends. I'm Shannon.
Shannon.
Yeah, we're live.
Yo, one time a couple weeks ago.
We are live.
Andrew's live.
Yeah.
Okay.
Okay.
Yeah. Guys, have a seat. We're dropping right into it.
It's just a short talk.
Or sand or whatever.
I'm gonna say hi to
chair?
the friends that are behind us live. We've got people live in person here in Carefree, and then we also have you all here on YouTube. I'm really hoping you can hear me because we've never done a YouTube live. So here we are.
Well, maybe we can get some feedback from the chat.
Maybe you can check. So we're just doing a little checks and balances here. It's not necessarily like Instagram Live where you can see people.
Right.
I don't. This will be short. It'll be about 15 minutes.
Cool if I could get some feedback, but I mean, it all looks. Oh wait, no, there's nothing showing.
I think.
Let me just
I
try
don't
to.
think we should do this sound.
Okay. Check.
It'll work. It's better.
Okay.
Hi, YouTube.
Let's just go, I guess. I'll kind of watch from here.
You on now?
Oh yeah, I mean that's an option too. I can just grab my phone and see if it's showing up on the other end.
Genius.
Make it look like we've got more
Yeah.
viewers. What's it called?
YouTube Live.
Well, I mean,
YouTube Primal Medicine.
Primal Medicine.
I'm not really gonna start until
Yeah,
you check because I don't really want to do it.
that makes sense.
No one can see. Primal Medicine.
Do you got it, Antonio?
Yeah, I think it was just us.
Okay. Okay, yeah, but it's going.
It's
now.
going. It's going.
There we go. You hear us in the back.
I hear it.
Okay, because you can scoot forward or back on the YouTube Live. Okay.
All right.
All right. Welcome. My name is Annie Adamson, and we're here in Carefree, Arizona, in our new clinic. And I wanted to take some time to talk about what is herbalism and yoga therapy. So a lot of what we do here in this clinic is individualized. So when you come to see somebody, I don't know if you ever have before, especially an herbalist, we're going to look at the body and everything that we're doing from a comprehensive holistic lens. So it's very different from allopathic medicine, which most of us are familiar with, Western medicine, where, for example, if you have a cough, you're going to be treated as if you have a cough. So you have a cough, I'm going to give you the cough medicine. As opposed to you have a cough, let's ask, what kind of cough do you have? Is the cough hot and dry? Is the cough damp and stagnant? Is the cough excited and it comes and goes, right? So we want to know what type of cough do you have, because as you look at that type of cough, it's going to matter how it's treated. So if you had a cough that was hot and dry, and then we gave you some sort of herbal formula that you picked up at the store that had warming, heating herbs in them that were also drying, you could potentially make your cough worse. Or if you had a cough that was stagnant and boggy and like stuck in your chest, and you go and you pick up some what we call kitchen sink formula, and you take it, which is all of these mucilaginous type of herbs, and they're cold and they're wet and they're sticky, you can suppress and make the cough worse. But in allopathic medicine, growing up in our society as Westerners, we're used to just use this for that, or take this and hope maybe something happens. Let's just hope it works. And so we throw all these herbs into a formula. And so we even get in natural care, or in, like, I would say, the green, natural, herbal world, we also get what's called green allopathic, where for me, people will go, well, I have this going on. What do I take? Well, then I'd be falling back into that same category of use this for that. And so we really try our best not to do that. So when I work with somebody, whether it's for movement, whether it's for their health, I'm going to take a look at what's going on with your tongue. Let me see your eyes. Let me look at your face. We're going to take your pulse. We're going to take into account How were you born? Were you born C-section? What was your childhood like? What kind of help did you have growing up? We look at the full comprehensive picture of somebody as an individual person, the pattern of that human, so that it matches the pattern of their symptoms, and then we can find the right protocol or the right plants that work and fit this person. And so it takes quite a bit of a strategy, because I have to practice every time I work with someone not falling into that green allopathic perspective, because it's really easy to do. Oh, you have this, just use this, and then I throw something at them, or throw all of these things into a formulation, and again, hope to God something works. And so what we're doing in this clinic when people come in is, the first time that they come in, we're sitting down together, me and that person, and it takes about 2 hours, because we're really looking in very in depth at that person's life. What brings you joy? What causes stress? How do you sleep? What are the things in your life that you're doing that are building creativity? In these different areas of your life, how do you feel stagnant? And oftentimes, where somebody feels stagnant matches with what's going on with their health. So maybe a woman is having a lot of urinary tract symptoms going on, and then we look at the whole picture of their life, and there's something going on where there's a lot of stress, or they're not sleeping very well. And so when we look at everything, we lay it all out on the table, we can really see together in a collaboration what's really happening. And so the other aspect of the work that I do is yoga therapy, and I've been doing yoga therapy for almost 2 decades. Yoga therapy is different than I think a lot of people would consider the way that I practice yoga therapy, or herbal medicine, or homeopathy. Everything's different. Even in yoga, you could take a yoga class with one person and take a yoga class with another person. It's always different, right? None of those are the same. It's very broad. And so I wanted to take time to explain what I do as a yoga therapist, because my practice has developed so much over the course of 2 decades. And what I really do when I'm working with somebody in the way of their pain or their movement is we're not trying to find out what's wrong and fix it, because I ultimately don't believe that anyone's broken. And yet, how do we step back and look at what's called our tendencies, or our habitual compensatory patterns? And so I've developed and created a system of movement called Primal Vinyasa and Primal Therapeutics. So we're going to pull everything back and actually, most of the time, undiagnose, and look at our movement patterns and our habits in a way of not trying to, quote, get it right. And so no longer as a yoga teacher do I teach specifically, this goes here and this is where it should be, and this goes here and this is what it's supposed to look like. And if I put you in this form and you're in the right alignment, now you've got it, you now have good posture because a second ago you had bad posture, right? There's this idea, what happens in the yoga world too, which is also very allopathic, where I'm not going to have somebody stand in front of me and boss them around, that I know what you should do. This is exactly how you should stand. And then once I tell you, you're going to get it right and you're going to feel better. It's more that I look at somebody as a reflection, and we can watch the way they sit, the way they stand. How are you bending forward to put on your shoes? What's happening when you're holding your baby, the way that you're sleeping, the way that you're moving? How do you spend the majority of your day? Because if I don't take that into account, and someone comes in to see me, and I'm going to give them 15 minutes of exercises to do 15 times a day to heal their shoulder, but I don't take into account how they walk their dog, how they bend forward and clean up their house, how they sit in their car, how they sit at their desk, I'm missing 95% of their movement throughout their day. And so the things that they do for 15 minutes are really obsolete compared to how they move. So I always start with somebody. I kind of trick them a little bit, because I'll set up the room and I'll be like, oh, the blocks are over there and the mat's over there. Oh, go ahead and grab the chair and move it over here. They think that I'm not setting up the room, but I'm actually watching them move, the way they pick up their chair, the way they move the blocks, the way they set everything down. I'm like, oh, come sit on the floor. Oh, wait, actually, I changed my mind. Come sit in the chair. After a few minutes, they've realized they're being assessed. But I can't really assess somebody by just having them stand there and let me look at you. It's really the way that we're moving when we're not consciously moving, where we can catch the most of our habits. And a lot of times people are pulling short on their neck, or they're, bending from a position where in their body they either buckle or they brace. So they're falling or using that same part of their body in a way that's hypermobilizing or hyper-structuralized. And so it is in those moments in between, in those places and spaces where maybe we're not conscious, that I can catch their habits. Then it's through the own observation of the person that is in here that they can start to sense that for themselves. Oh, every time I sit at my desk to work for 3 hours, I do this. Maybe it's contributing to my headache, right? Or every time that I have a toddler and I pick things up off the floor 35 times in 20 minutes, I either have an opportunity to feel worn out and tired, or I have an opportunity to bend down and pick that up in a really well squat, and I'm getting stronger and more stable. So it's through the awareness that we're building together in that session that the real magic starts to happen. It is actually, in my perspective as a clinician, it's only through the awareness that we're building that we can make any changes. And so my job isn't a healer over someone, or again, to tell someone how to move or what exactly is the right thing. It's how can we step back and then build that awareness on our health, our movement patterns, and the process of that is really important. And I don't think that a lot of us get an opportunity to have that perspective when you go in for care. It's more like, fill out this thing, and then I'm going to give you something, or I'm going to tell you what to do. It's not a collaboration. And I think that we're missing that in the health and wellness world, because when it is a collaboration and we really get deep into what it is that somebody wants, and most of the time I have found that people want a life of vitality. People want to feel well. They want to know themselves more. They want to live in their heart. They want to be more in their bodies, but they don't oftentimes know how to do that. So I'm just not interested anymore in teaching or working from a place of should or shouldn't, and instead building a pathway of observation and awareness so that we can all have more vitality. So that's what we do here at the clinic. If you're interested, you can check out our website. You can sign up online. I have a scheduling through Acuity there, or you can send us an email if you have any questions. But we're going to give you a tour around the space. And if you ever find yourself in Carefree, Arizona, please come and visit us. Thanks for listening, everybody.
That was awesome.
All right.
Thanks, you guys. Thanks for listening.
Thanks for listening to the talk, guys.
Yeah.
I was going to show you around this new space a little bit. So right here, this is where we're doing our live classes, and where it's our set for our on-demand classes as well. And then we just have this little hallway down the way. It's a very small space. Here's our facilities here. And then the front of the building is our reception area. So front door, let's see, got to get better lighting here. And then our front desk is here, and we have a number of different supplements that we're offering here, as well as some products. Most of these herbal products are homemade by Annie and my son Tabor. And then we have all of our herbs for making teas that are also available. So if you're working with the herbs to support your practice, that's all here as well. And so, yeah, it's the gist of the space. Back in here, you can see where the Nacharaj now lives, and the people. What's up? Yeah. So thank you so much for tuning in. It's a joy and a pleasure to share this new chapter with you all. And please reach out if you have any questions, or if there's anything we can do to support you in your health and wellness journey. Again, much love and appreciation, and we hope to see you soon. Be well.